Hi, everyone. I'm Madeline Heim, the Health and Science reporter for the Post-Crescent and USA Today Network Wisconsin. In a matter of weeks, COVID-19 has gone from something that no one knew a whole lot about to the thing that everyone is talking about. It's closed schools and restaurants and businesses. It's put nursing homes at risk. It's sent hospitals scrambling to get masks and ventilators. And most recently, it even put pressure on Wisconsin's spring primary, as we saw a couple days ago. As journalists, we have a lot of questions about how people are being affected by the pandemic and how prepared our health systems and our government agencies are to handle it. And we know that you have a lot of questions as well. So this week, we are kicking off Newsmakers Coronavirus Edition, where I'll be talking to Wisconsinites who are on the front lines of the crisis about what they're doing to help. And this week, we are starting with Kurt Eggebrecht. He is the Public Health Officer for the City of Appleton. Kurt, thank you so much for joining me, and how are you?
Very good. Thank you for having me today.
Thanks. So I wanted to start by looking back a little bit. You've obviously been in your role for quite some time, and you've had to deal with a lot of different public health crises, swine flu, measles, whooping cough, and everything like that. And I'm just wondering, what to you makes the novel coronavirus pandemic that we're dealing with now stand out, or what makes it different from what you've seen before?
Yeah, it does create some challenges. By its nature, novel means that this virus has never circulated before in the human population. So we have a little disadvantage from other diseases that we know a lot about them. We know how they're transmitted. We know how to prevent them. We know if there's treatment modalities that can be applied. With this particular virus, we don't have that. And so we're learning as time goes, how is this disease transmitted? What is the incubation period? Who is greatest risk? All of those are learning things that we have to do in real time because this has never circulated in the population before. So it literally is a world event. We're learning from other countries, and we're learning from places within our country that are having higher rates. And as we go, we refine our knowledge and our response to this virus.
Yeah, definitely. I can definitely see how the newness would play a big role in that. So I'm curious, how you would describe the city health department's role right now in handling the pandemic in the city of Appleton. What are you and your staff's most crucial jobs during this time?
Yeah, I think the biggest value we bring is really knowledge and really being truthful and honest with the community, what we know, what we don't know. We still don't know the long-term ramifications of people who have had this virus. For an example, that's something we won't know for time. But what the role that I think we play is providing the best knowledge we have to make the best decisions we have for our community. And that's a critical role. Like other communicable diseases, our public health nurses play a critical role in terms of contact investigation. So as people are identified as having this disease, they go back in time. They interview or find information from a loved one where that person was at the time they contracted the illness. And we try to go back in time and then decide who else needs to know that they may have had an exposure. So they themselves can monitor their health status. And if that does change, then they can quickly get the help that they need. So it's that contact investigation and that work to educate those people who may have had contact with a positive case that really helps to eliminate ongoing spread within the community.
Yeah, absolutely. So yeah, there's obviously a lot of great work being done by local health departments across the state. But then, of course, there's the State Department of Health Services, which is sort of taking a broader view and looking at, all the different counties combined and how the virus is spreading across the state. And so I'm wondering, when you talk with DHS, how are you coordinating with the state health department? And, when you talk to them, what are you asking them about, and what help are you hoping that they'll provide the city?
Yeah, you're exactly right. That's true with any disease. We have a network that
Oh, I think we may have briefly lost Kurt.
afternoon phone call. And that's something that we have real-time communication with them through that process.
Gotcha. Yep. That makes a lot of sense. So another thing that I wanted to touch on as well is the concept of modeling. So obviously no one knows what this is going to look like, but we all kind of want to know when things are going to peak and when our resources are going to be most used and when they could be most scarce. And I know that there are a lot of different models out there. Some of them are more conservative than others, but I'm curious about what ones that you are looking to determine, when things might peak around here.
Yeah, we do look at different modeling. That is a tool, but we also look at boots on the ground, so to speak, and that's really how is our mitigation strategies playing out in our community, because that can influence these models dramatically. And I know you know this. We have worked very hard at doing a lot of education up front and really getting people to better understand the value of social distancing from a historical perspective. And we've really benefited from studying the 1918 influenza pandemic and how some communities succeeded and others did not. And those strategies are what we're applying here. And we've worked very hard with our school community, our faith-based community, our jails, our shelters, places that we know are at high risk, and tried to do some upfront education that really, I believe, is paying dividends today. So your question's a good one. I do see that some of those indicators are the modeling, and then also taking information real time from what we're seeing in our hospitals, our healthcare settings, the tests that we're taking, and then really the behavior of the community in regards to those social mitigation strategies.
Yep, that definitely makes sense. So as of right now, I had just looked before this, and I believe that we still have 7 confirmed cases in Appleton, is that correct? And then I think there's 26 right now in Allegheny County. And I'm wondering, what you make of there not being a lot of cases here right now, because obviously we're a smaller community than Milwaukee and Madison, but they are dealing with like a ton of cases. And I'm wondering particularly if you think that the fact that this area doesn't have a lot of cases yet means that we could be peaking later than some of those larger urban areas, or if you think the state will peak as a whole pretty much at the same time.
Yeah, I'd like to hope through our efforts, and time will tell if this is true, but rather than a peak, which is often used in the descriptions, I'd like to think of a half moon turned on its side. And I think the efforts I just described, we're hoping that we really smooth those number of cases over a longer period of time, rather than having a dramatic rise and then coming back down. I will say with that, I anticipate our number of cases are going to rise dramatically in the coming weeks and months. And I think that we will see unfortunate outcomes coming to our area this summer. So certainly we can't rest now. We have a lot of work to do, and the work we've done is good, but we can't let up on that. And that's the challenge of educating the community on, when they see low rates, they don't often equate risk. And certainly in public health, we see that differently.
Yeah, and that actually goes right into my next question, which is, if things turn out pretty much as well as they can here, which I think we would all like to see. But, let's say that there aren't actually a lot of cases that appear here, which, would be great. But what do you think that the general public will make of that? Do you think that people will view that as like, oh, our guidelines were a little bit overkill? Or do you think that people sort of grasp the gravity of the situation? And do you think they see that, the practices that we're doing right now is actually what's helping us?
Yeah, I think time will be a better judge of that. I can tell you that in my preparation for the 1918 strategies that prevent illnesses in the first place. So I think messaging is important, But I think that if we use history as a guide and we use science as a guide steps forward, we put our community in the best position we can.
Yeah, that definitely makes sense for sure. So one thing I wanted to touch on, again, just sort of looking back a little bit to when this all first started happening in our area. I know that when I first started reporting on it, which was probably the end of January or so, there was a lot of emphasis around reiterating to people, this is super low risk. This is very low risk. You're much more at risk for getting the flu. And I think we saw, some local health officials in certain areas and sometimes even state health officials sort of playing it down like that in the beginning. I'm assuming just to not create panic for people. And I know that you've been watching it for quite some time and you've never been the type of person to super downplay a risk, but I'm wondering now that we're almost, 30 days out from when it really started to pick up in Wisconsin, how do you feel about your early response to it? Do you think that you were able to kind of look at it and see what we were up against from the beginning, or are there things you would have done differently? Or, how do you feel about how your early reaction to the virus?
I think you have a couple of really good questions within that question. The environment that we're working in, people are getting information from a variety of sources. And I think some of those compete with each other on messaging. And the narrative I have always tried to portray is, again, truthfulness of the science. And we're learning what happened in other countries before our own country. And then we learned right here in America, some of the early experiences of Seattle, Washington in particular, and now New York City. Those are lessons that we can draw from. And the conclusions I make is this is a very, very dangerous virus. And to think otherwise or to compare it to a seasonal influenza, I think is off the mark. Or to imply that there's a medication out there that will cure people is misleading. And I think we need to be very truthful with our people. And that's how we'll gain compliance to do the social distancing. If we can demonstrate that it works, but it takes everyone to be a part of that and to really prevent the illness from spreading.
Yeah, absolutely, for sure. And then so the last question that I have before I think we go to a couple viewer questions, I'm wondering, what cues that you will be looking for as far as when to ease up on some of the rules that the city has put in place, as far as businesses, opening things back up like the library and city hall and everything. What signals can we look for as far as when things might be slowly starting to return back to normal? What do you think that looks like?
Yeah, that's an awesome question. And I think I view it almost at the tail end of how we started. So you might recall we closed schools. We met with our faith-based community. We very quickly moved into local public laws, actually, of our long-term care facilities. All of those strategies were really taking the science behind who's most vulnerable to get this disease. And what we learned from other areas is that people of age have the most at risk. And so we really tried to message that and educate, how do we protect those most vulnerable from having adverse outcomes? And so that has been our message. And as we fortunately see the other end of this, which I believe will be quite some time. In fact, I don't think we can rest until we have a vaccine, which would be next spring at the earliest, that really helps this particular virus. I think you'll see that we still want to protect those most at risk. So any easing of restrictions has to keep in mind of how do we still protect those most vulnerable. So again, taking those indicators of the testing, of the hospitalizations, of the fatalities, where we're seeing pockets within our state. So if we were to ease, but we have high rates in Green Bay, Madison, or Milwaukee or closer, we have to take that into consideration. We're a mobile society. So those are all variables that I'll be looking at very closely and coordinating that with the state of Wisconsin, because this will have to be a coordinated effort throughout the state.
Yeah, Yeah, absolutely, for sure. Let me see about our reader questions, or excuse me, I should say our viewer questions. Sorry, I'm usually in print, so I had to go with readers. Okay, so we have one from Facebook from Maddie Burns. He asks, while the 1918 pandemic is a good thing to study, what about the most recent history with COVID-19 and other countries that have dealt with it? What best practices are you learning from them?
Yeah, right on, because they are two different illnesses. Many similarities, though, in terms of transmission. What we're learning and studying right now, for me, is interesting in China, for example. Is there going to be a second wave? And as they're loosening their restrictions, as we just discussed, people are going back to work, they're going back to school. What's the ramifications of that? Will they see a second wave, as we did in 1918 with the pandemic? We had a first wave, and the second wave came shortly after they eased those restrictions. And so those are really good lessons and things that we're watching, both in China now, but we'll be monitoring South Korea and Italy after that. And just to see how different decisions result in different outcomes and learning from that.
Yeah, absolutely. And before we wrap up, I just have one more question for you. I know that the news can be sort of intense right now, and there are a lot of really heavy things that we have to deal with, and it looks like that we are not close to getting out of this anytime soon. But I'm wondering, what you see in all that you're looking at that makes you hopeful. Is there any bright spot that you can see coming out of this, or anything that viewers can hope for concerning what we've all gone through with this?
Yeah, I see a lot of silver linings, and I know they're hard to see right now, but the valuing of relationships within our community, the kindness that people are showing, the wanting to support and help each other. There's many examples across the community, within neighborhoods, within the church communities. I am just so impressed. And I think those are the things to lay a foundation on as we come through this. We are going to be a better community. I believe that with all my heart. And it's those relationships that are going to do that.
Yeah, that is a great message, and I've noticed that as well. So that is really great. And with that, we are going to finish up here. But Kurt, thank you so much for joining us. And for everyone who's watching, thank you for tuning in. This particular show will be back in 2 weeks, April 22nd, where I'll be talking to State Deputy Health Secretary Julie Willems Van Dyke. But until then, I hope you all stay safe and healthy. And thanks for watching, and have a great day.